Beetroot juice is all the rage with marathoners, Olympians, football teams, and along with those who are hoping for improved heart health. And does beetroot juice, the juice from those big old beets, have benefits to you after weight loss surgery? Yes, it does. 3 you should know about right after this.
ProCare Health offers easy and affordable solutions with once-daily multivitamins, including our new DS and SADI surgery formula, increased iron, A, D, E, and K. Still just 1 capsule a day. Visit ProCareNow.com and use code Susan60 to get a free bag of protein powder with $60 purchase.
Hi, I'm registered dietitian, nutritionist Dr. Susan Mitchell, ex-radio dietitian turned podcaster. You're listening to the Bariatric Surgery Success podcast, episode number 95. I'm here to help you cut through the health hype, give you accurate, evidence-based nutrition information worthy of all your time and efforts. Simple, step-by-step strategies that can change your life today. I want you to feel really well. Every day, get out there, do all the things on your list that you want to do. This podcast, it's for you. First, our Science 101 on beets and beetroot juice, also known as AKA beet juice. So beetroot juice, beet juice, one and the same. Beets are a root vegetable. They're packed with vitamins and minerals like vitamin C, fiber, folate, manganese, potassium. And you can find beets that are that typical dark red color you're so familiar with, but also golden yellow, white. And have you seen the rainbow colored ones? By the way, those green leaves that grow out of the beet are also edible. Who knew, right? And you prepare them similar to, say, Swiss chard. So before I jump into the benefits, let me mention your pink pea. You heard me. Listen closely. We're talking about your pink pea. What happens, your urine may be red or pink after eating beets or drinking beetroot juice because of what's called betalins in the beets. Your poop, by the way, may also turn reddish as well after eating beets or drinking the juice. So both are normal. You don't have to think, what's happening? Why do I have what looks like blood in my urine or in my poop? If you're eating beets, drinking the juice, that's pretty typical. What makes beets and beetroot juice more special is that they contain what's called dietary nitrates that ultimately increase nitric oxide in the body, also known as NO. This increase in nitric or nitric oxide, NO, helps improve circulation and dilate blood vessels, potentially big perks. So let's talk about those 3 benefits. Benefit 1. Enhanced performance for athletes or everyday workouts. The dietary nitrate supplementation with beetroot juice may improve exercise performance. Your exercising muscles benefit from that increased blood flow. The amount of oxygen needed is reduced and the time to exhaustion is lengthened. So these are benefits of, and don't miss this, regular whole beets or beet juice consumption. So either or. You really hear a lot more in competitive sports about beet juice or beet juice powders just because they're so much easier to consume when you're training. In the elite sports world, shaving off seconds or lasting longer may make all the difference to win. And you may find this benefit of beets to be helpful over time with your workouts. To have success with beetroot juice, it must be part of your training if you're using it for an event and then started ahead of the event, preferably at least a week or more, and then consumed on a day-to-day basis. So it's not a one-time wonder. If you just Google beetroot juice, you'll find all types of products. So an important point to remember, don't miss this, is that the benefit can come from whole beets that you roast or prepare however you like them, or beetroot juice, even beetroot shots with names such as Red Ace or Beet Elite. Okay, let me say this. Beetroot juice is an acquired taste, or it was for me. So sometimes you will see it mixed with something like cherry juice or cherry powder to add a little bit of sweetness. Some of the products that you purchase will do this for you. Sports dietitians will be the first to tell you, though, that it's still the quality of your overall diet that counts. And beetroot juice just tops off that excellent diet. Well, what exactly do beets or beet juice mean for you after your weight loss surgery? The best choice for you would be what form? Beets or beet juice? Which do you think? Think about it. Okay, you got it. I know you have it. Whole beets versus juice. Why? 2 reasons. Number 1, that feeling of fullness or satiety you get from eating the whole beet, which includes the fiber that really helps prevent the big C word, constipation. So common after surgery, right? Okay. I know you're saying to me, really, I don't like beets. To be frank, neither did I. What changed my mind? Roasting them with extra virgin olive oil. Roasting is a fabulous way. It softens the beets and you get this amazing caramelized, naturally sweet flavor. Makes them really tasty. You've got to try it and email me or post on any of my social media. How did you like them roasted? I'm now a fan of roasted beets, I can tell you honestly, and I learned how to roast them easily from my friend and colleague, dietitian Regina Rigoni. Be sure you got to try this recipe she did for us called Rush Hour Ready Beets. I'll put the link in the show notes, but you can find the recipe on my website as well, breakingdownnutrition.com. It's under recipes. Okay, number 2, benefits. Beets and beet juice are anti-inflammatory, something we hear so much about, right? Which foods are anti-inflammatory? Well, beets and beet juice are, and they're nutrition powerhouses. What makes them unusual, remember, is that they contain betalains, which give beets that beautiful red, purple, and yellow-orange color and fight inflammation in the body. Beets provide other natural compounds, beneficial compounds called flavonoids and carotenoids. They all work together. Think of it kind of like a basketball team. And bonus, 1 cup of beetroot juice also contains folate, vitamin C, magnesium, potassium, and more. Remember that we mentioned at the very beginning when we were talking about our Science 101 of beets. Powerful nutrition for your body. Powerful. 1 teaspoon or 5 grams of beetroot powder added to about 4 to 6 ounces of water is around 15 calories and 4 grams of carbs. Typically no added sugar depending on the brand. So you do have to look at the label closely. I'm looking one right now called Super Beets. So you could dilute this down with another 4 ounces of water if you wanted to, and then that would bring your carbs down to 2. So the benefits would be reduced some as well, but you'd also lower your carbs. So a couple of ways that you can do that. And how about this benefit number 3? Beets, beetroot juice naturally lower blood pressure. You remember why? The nitric oxide, right? The NO that helps improve circulation, dilates those blood vessels, which in turn lowers your blood pressure. So the key is that the beets or the beetroot juice need to be a regular part of your diet. Just an every now and then kind of thing is going to be great in terms of it's just a healthy part of a diet, but it's not going to give that day-to-day benefit we're talking about for inflammation, anti-inflammatory properties, or your athletes or your workout, or in this case, blood pressure. So what happens is once you stop beetroot juice, the blood pressure tends to return to where it was before. So it either has to be a pretty regular part of the diet or eaten along with a lot of other leafy greens, vegetables, because remember, they benefit blood pressure as well. So for you, whether it's improving your workouts, the anti-inflammatory properties that are great after surgery, or blood pressure benefits after surgery, the beet goes on, and it's beneficial to your journey because you're worth it.
Bariatric Surgery Success with dietitian Dr. Susan Mitchell is produced and owned by Practicalories, LLC. All rights reserved. Remember, the content provided on this podcast is for information purposes only and doesn't create a patient-provider relationship. It's intended to provide reference material and is not designed to provide medical advice. Please consult your healthcare provider regarding any medical issues you have relating to symptoms, conditions, diseases, diagnosis, treatments, and side effects. Podcast guests express their own opinions, experience, and conclusions which do not necessarily reflect or agree with the host, Dr. Susan Mitchell, or Practicalories, LLC.